Well, hello and welcome once again to day 2 of World Health Expo Tech. Our guest here is Sunil Shinde from Cuezen. Sunil was just saying how impressed he is with WHX Tech. Sunil mentioned that this isn't just another conference, but a catalyst. Sunil, you mentioned that there's such a focus on prevention. So what makes WHX Tech so different?
We are here to show the technology that we have built where we bring together wearables data and clinical data to help a patient or a member guide them in a very personalized way to staying healthy. Anita, when I look at Middle East, the progress that Middle East has made in the last 25 years, everything that we see in terms of infrastructure and technology is fantastic. The focus that GCC has on providing the right level of healthcare for all the residents of GCC is eye-opening, especially the focus on prevention as the way to manage costs early on is one of the reasons that we are excited about this region. Everything that we see as innovation in healthcare somewhere has its roots in what we saw in the COVID pandemic. We saw how health systems and the health infrastructure was not sufficient to manage what happened at a very, very global scale. Cuezen is focused on keeping people healthy outside of hospitals. Once you walk out of a hospital or before you go to a hospital, and God forbid you never have to go to a hospital, taking care of yourself and your loved ones through prevention and managing your chronic care is what healthcare is about, which is where Cuezen is focused.
I'm joined by Nick from Opmed.ai, which is a US-based AI healthcare startup company. And Nick is here showcasing at WHX Tech.
We're a Boston-based AI healthcare startup where we help with OR and procedural-based scheduling, where we use AI to predict overestimations and underestimations of time and actually create an alternative schedule optimized for increasing capacity or actually reducing costs. One of our earliest partners, Mayo Clinic in Rochester, we worked with their cardiovascular department and where we deployed our solution, and we were actually just by using our predictions, leveraging AI, we were able to reduce a scheduling error by 50%. And that 50% led to an increase of 500 additional cases, or the equivalent of opening a room for 6 months, just by using our AI prediction model. We're really interested in becoming a vertical platform. And a vertical platform that touches on areas like rehabilitation. We've actually have our first rehabilitation client in the US. Radiology, I mentioned the procedural space, moving into the inpatient setting as well as the emergency department. So our core engine is really leverageable across the continuum. And the other piece of this from a technology perspective is also Agentic AI. We're really, really excited to introduce Agentic AI into our solution and start being able to present real-time recommendations to administrators to help prevent bottlenecks before that they happen.